So coming to the histology of urinary system, in the histology of urinary system, we will learn about, we have to know about 3 slides, that is kidney, ureter and urinary bladder. So coming to the kidney, it is covered by, in the histology of kidney, it is covered by a capsule, and from the capsule the kidney divides into cortex and medulla. Okay, so in the cortex we have Bowman's capsule or renal corpuscle. Renal corpuscles are seen in the cortex. Along with the renal corpuscles, we will able to see, along with the renal corpuscles, in the cortex of the kidney, you will able to see the proximal convoluted tubules. The proximal convoluted tubules, they are lined by columnar epithelium or simple cuboidal epithelium, and the upper part of the cells shows striations. Striations means they are nothing but the upper part of the cell shows striated border. The striated border is nothing but numerous microvilli are present. So when we take the proximal convoluted tubule, it has small lumen compared to the distal convoluted tubule, and the cells are simple columnar or cuboidal, and nucleus, it is situated at the center, and the apex of the cell shows numerous striations. The apex of the cell shows striated border, which is nothing but presence of numerous microvilli are present. The upper part of the cell consists of numerous microvilli, thus way they are striated appearance. So the proximal convoluted tubule, it is lined by simple columnar or cuboidal epithelium, which is with the striated border. Striated border is because of numerous microvilli. So that's the proximal convoluted tubule is also seen in the cortex of the kidney. Proximal convoluted tubule is seen in the cortex of the kidney. The cells are cuboidal or columnar with a striated appearance. Proximal convoluted tubule. They are cuboidal or columnar cells. Okay, along with the renal corpuscle. And coming to the distal convoluted tubule, the distal convoluted tubule has a large lumen when compared to the proximal convoluted tubule, and the cells are not striated here. They are lined by columnar or cuboidal cells. How can we distinguish the proximal convoluted tubule cells from the distal convoluted tubule cells? Means the proximal convoluted tubule has comparatively small lumen when compared to the distal convoluted tubule, and the distal convoluted tubule has a large lumen, and the proximal convoluted tubule cells, they have a striated in appearance. Because they have striated border because of the numerous microvilli, and the distal convoluted tubule does not have striated border. Okay. Thus also in the cortex of the ovary, you will able to see the renal corpuscles. That means renal corpuscles consists of Bowman's capsules lined by flattened epithelial cells. The Bowman's capsule lined by flattened epithelial cells along with tuft of capillaries. So the entire one we called it as renal corpuscle. The renal corpuscle consists of Bowman's capsule along with tuft of blood capillaries. So in the tuft of blood capillaries, the afferent and efferent arterioles are present in this space. Okay, so Bowman's capsule, in the Bowman's capsule you will be able to see, along with the Bowman's capsule you will be able to see tuft of blood capillaries. The entire Bowman's capsule along with tuft of blood capillaries, we called it as renal capsule, which is seen in the cortex of the kidney. Along with the renal corpuscles, you will be able to see the proximal convoluted tubule as well as distal convoluted tubule. This is proximal convoluted tubule and this is distal convoluted tubule. Okay, so the proximal convoluted tubule, it is lined by simple columnar or cuboidal epithelium which has striated border. Striated border means numerous microvilli are present. So the cell of the proximal convoluted tubule. Because why striated border means nuclear microvilli are present at the top of the cell. Thus way the cells are striated in appearance. And coming to the distal convoluted tubule, the cells are not striated appearance. They are lined by simple columnar or cuboidal epithelium, and the lumen is comparatively larger when compared to the proximal convoluted tubule. That's about these renal corpuscle, proximal convoluted tubule and distal convoluted tubule. They are seen in the cortex of the ovary. And coming to the medulla, in the medulla of the ovary, in the medulla of the kidney, so in the cortex of the kidney, you will able to see the renal corpuscles, proximal convoluted tubule and distal convoluted tubule. And coming to the medulla of the kidney, you will able to see loop of Henle, which are lined by flattened epithelial cells, and also collecting ducts are there. Collecting ducts have large lumen and they are lined by cuboidal or columnar epithelium. Collecting ducts are there. The collecting ducts have large lumen when compared to proximal convoluted tubule and distal convoluted tubule. So in the medulla you will able to see the loop of Henle, and also collecting ducts are seen. Their collecting ducts are very, very big. So these are collecting ducts. So kidney, it is covered by capsule, and in the cortex you will be able to see the renal corpuscles, that is nothing but the Bowman's capsule surrounded by Bowman's capsule and the tuft of capillaries we call together as renal capsule, and the space here between the cup shaped Bowman's capsule, the space we call it as urinary space. Urinary space. And the renal corpuscle, it is lined by flattened epithelial cells. These flattened epithelial cells lined by flattened epithelial cells. These flattened epithelial cells we call them as podocytes, because when we take the microscopic section of the podocytes, they have foot-like projections. So these epithelial cells, they are called podocytes, and tuft of capillaries are situated here, and the space here we call it as urinary space, and this is called it as the lumen of the Bowman's capsule. It is continuous with the lumen of the proximal convoluted tubule. Proximal convoluted tubule, and this pole we call it as urinary pole. This pole we call it as urinary pole. Okay. So in the cortex, we will be able to see the renal corpuscles with the tuft of capillaries, proximal convoluted tubule which is lined by striated border, columnar or cuboidal epithelium, and distal convoluted tubule, they have comparatively large lumen when compared to the proximal convoluted tubule. These three structures, they are seen in the cortex of the ovary. And coming to the cortex of the kidney, and coming to the medulla of the kidney, it consists of loop of Henle and collecting ducts. The loop of Henle, they are lined by flattened epithelium, and collecting ducts, they are very large lumen. They have very large lumen and lined by cuboidal epithelium or simple columnar epithelium. So that's about the kidney. So when we take the section of, when we take nephron, so this is the proximal convoluted tubule, and is the loop of Henle. And from the loop of Henle again, distal convoluted tubule is there. From the distal convoluted tubule, they open into collecting ducts. So capillaries, tuft of capillaries are there where the afferent arterioles and efferent arterioles are present, and this is the Bowman's capsule, and this is called urinary space, which is continuous with the lumen of proximal convoluted tubule. This is the proximal convoluted tubule, and this is loop of Henle, and this is the distal convoluted tubule which opens into the collecting duct. Okay, that is the brief structure of nephron. So that's about the histology of kidney. Coming to the histology of ureter. Coming to the histology of ureter, here the mucosa is thrown into more number of folds. That's why star-shaped lumen is seen in the ureter, and it consists of 3 layers. From inside out, mucus layer, mucosa, and muscle layer. Mucus layer, muscle layer, and fibrous layer. Right. So 3 layers: mucus, muscle, and 3 layers from inside out. So the mucus of the ureter is thrown into more number of folds. This way, in the ureter, you will able to see star-shaped lumen is there, which is lined by transitional epithelium. In the transitional epithelium, you will see the base cells are cuboidal or columnar cells, outer polyhedral cells, which are 4 to 5 layers, and outermost cells are umbrella-shaped cells. So the characteristic feature of the ureter is transitional epithelium. Transitional epithelium will see inner cuboidal or columnar cells, outer 4 to 5 layers of polyhedral cells, outer 4 to 5 layers of polyhedral cells, and the outermost layer consists of umbrella-shaped cells. These umbrella-shaped cells, they help in the stretching of the urinary bladder. So the transitional epithelium consists of basal columnar cells, outer 3 to 4 layers of polyhedral cells, and these are umbrella-shaped cells. And inner are the column, cuboidal cells. That is transitional epithelium. So the mucosa of the ureter, transitional epithelium. So the mucosa of the ureter, it is thrown into more number of folds, giving the lumen as star-shaped appearance. The mucosa of the ureter, it is lined by transitional epithelium, which consists of outer cuboidal cells and 3 to 4 layers of polyhedral cells, and outermost layer consists of umbrella shaped cells. Inner cuboidal cells, 3 to 4 layers of polyhedral cells, and the outer layer of cells consists of umbrella shaped cells. They help in the expansion of the ureter. They help in the expansion of the ureter. The layers of the ureter becomes thin during expansion. The layers of the cells, the transitional cells, they become thin during the expansion of the ureter. So this is the mucosa lined by epithelium. Outer layer consists of fibrous tissue. In the connective tissue, you will able to see some blood vessels, diffusal lymphocytes, and some collagen fibers are seen in the this is the connective tissue layer, and this is the mucosa. This is the connective tissue, consists of some blood vessels, diffusal lymphocytes, and some collagen and reticular fibers are seen. And outer to the connective tissue layer, you will able to see thick muscle coat, inner and outer longitudinal and middle circular muscle coat is seen. Inner and outer longitudinal. This is the longitudinal muscle, because when we take the section of the ureter, the longitudinal muscles appears like this. So it consists of, the muscle layer consists of inner longitudinal, middle circular, and outer longitudinal. So we know that the smooth muscle cells are spindle shaped cells. That's why I am drawing the smooth muscle cells are spindle shaped cells. They have flattened nucleus, and the cells are spindle shaped cells with tapering nucleus. This is the circular muscle layer, and again outer is the longitudinal muscle layer. So in the ureter you will able to see star shaped lumen and thick muscular coat is seen. Inner and outer longitudinal, middle circular. So inner and outer longitudinal, middle circular. So the mucosa is thrown into more number of pores, which gives the ureter a star-shaped lumen. The mucosa is lined by transitional epithelium. That's important, very very important, because transitional epithelium is the characteristic epithelium of the urinary system, because it lines the ureter as well as urinary bladder. Because of the umbrella-shaped cells, they are able to expand and the layers become thin. Okay, so the mucosa is lined by transitional epithelium, and outer to the mucosa we have connective tissue, which consists of blood vessels, some diffusal lymphocytes, and some fibers. And outer, the next layer is the muscle layer. Muscle layer, it is very thick and consists of inner and outer longitudinal, and consists of inner and outer longitudinal muscles, inner and outer longitudinal muscles, and middle is the middle layer, middle circular. Okay, middle circular. So muscle layer, it is very thick and it consists of inner and outer longitudinal, middle circular. And coming to the fibrous layer, it is situated outside the muscle layer, and it consists of some few diffusal lymphocytes are there in the fibrous layer, some connective tissue fibers are there in the fibrous layer, and some adipose tissue is also, can see the adipose tissue in the ureter, some diffusal lymphocytes, some blood vessels, and some fibers are seen in the fibrous layer. So the mucosa consists of more number of, this is the fibrous layer, fibrosa. It consists of diffusal lymphocytes, some blood vessels, and connective tissue fibers. So coming to the mucosa is thrown into more number of pores, giving star-shaped lumen. It is lined by transitional epithelium. Outer to the mucosa we have connective tissue, some blood vessels, and lymphocytes are seen, and thick muscle coat is seen in the ureter. That is the characteristic feature. One is star-shaped lumen and the second one is thick muscle coat. These are the two characteristic features. Where we see in the slide, we will be able to see the star-shaped lumen as well as thick muscle coat. That is the most important characteristic feature of the ureter. And outer to the inner and outer longitudinal, middle circular, and outer to the muscle layer, you will be able to see the fibrosa consists of connective tissue fibers, diffuse lymphocytes, and some blood vessels. That's about the blood vessels. So that's about the ureter. So ureter consists of star-shaped lumen. Okay, and coming to the urinary bladder. So urinary bladder consists of mucus layer, mucosa, lamina propria, muscle layer, and outer layer is serosa. Okay, coming to the mucosa of the urinary bladder, it is lined by transitional epithelium, because the transitional epithelium is the characteristic epithelium of urinary system. It consists of lower cuboidal cells and upper 3 to 4 layers of polyhedral cells and outer umbrella shaped cells. Okay, that is a characteristic feature of the transitional epithelium. And in the lamina propria, of transitional epithelium, you will be able to see mucous acini. Mucous acini, we know the structure of mucous acini, where the mucous acini consists of cuboidal cells with flattened nucleus at the base, and the remaining part of the cell consists of more number of mucigan glands. So the mucous glands, they open into the mucosa. Okay, the mucous glands, they open into the mucosa. And coming to the muscle layer, like ureter, it consists of inner and outer longitudinal, this is the inner longitudinal muscle layer, because when we take the section, you have to draw the longitudinal muscle layer like circles. Inner and outer longitudinal and middle circular. We know that smooth muscle has spindle shaped cells with tapering ends, and the nucleus is flattened and elongated. So this is the middle circular layer with flattened nucleus, the spindle shaped cells with tapering ends, the smooth muscle, circular muscle cord, and again outer longitudinal muscle cord. This is the longitudinal muscle layer. The muscle of the urinary bladder, it is very thick, and we call this muscle as detrusor muscle. The detrusor muscle is called the smooth muscle of the urinary bladder, which is in voluntary control. Here the smooth muscle acts as voluntary in action, because when we want to micturate, then only we micturate. But the smooth muscle, usually the smooth muscles are involuntary. But here in the urinary bladder, the smooth muscle works as voluntary muscle. Because when we would like to micturate the urine, then only we will micturate the urine. So coming to the mucosa, consists of epithelium, and lamina propria consists of mucous glands. And coming to the muscle layer consists of inner and outer longitudinal, inner and outer longitudinal muscle layer, and middle is the circular layer, middle circular and The outermost lining is serosa, which is nothing but lined by flattened epithelium. Serosa layer. Okay, this is the serosa layer. So that's about the urinary bladder. So urinary bladder consists of mucosa. Mucosa is lined by transitional epithelium, and lamina propria consists of mucous glands which opens into the mucosa. And coming to the muscle layer consists of inner and outer longitudinal middle circular. It is a thick muscle coat. We call this muscle as detrusor muscle. Detrusor muscle. Detrusor muscle. And outer layer is the serosa layer, which is nothing but lined by flattened epithelium. So that's about the urinary bladder. That is the histology of the urinary system. కొంచెం క్లీన్ చేసేసాను.